Imagine you're driving a motorcycle at a high speed. Suddenly, you get distracted and fall. These type of situations could cause a cervical sprain, which is a traumatic injury on the soft tissue of the neck that occurs when the movement of the neck and spine are too extreme. This is also known as whiplash. Other risk factors can be poor posture, bone fracture, and bad sleeping positions. Cervical sprains are very common when playing a sport. Worldwide, 4 of every 1,000 people get a sprain in the neck. Luckily, it's very unlikely to die from this injury.
Cervical sprains are caused by falls or sudden twists that overload or overstretch one or more joints in your cervical spine, or it can be repeated stress to the joint.
The spinal cord is protected by the cervical spine, which supports the head and allows a significant amount of range of motion. 7 cervical vertebrae stacked vertically comprise the skeletal portion of the spine. Each vertebra, except for the first 2, has a ring of bone formed by a laminate of pedicles posteriorly. This protective ring of bone forms the spinal canal, which surrounds and protects the spinal cord. The C1 vertebra, or atlas, is ring-shaped, has a large lateral masses, and attaches to the occipital condyles of the skull, providing support. The vertebral body joints can be injured when a cervical sprain occurs. But how can you know if you have a cervical sprain? Common symptoms are pain in the back of the neck, difficulty to move your head or neck, and headaches.
If any of the symptoms are present and you have a reason to believe that you have injured your neck, what should you do? Go to the doctor, where he will probably do a physical examination of the injured area. MRI may be used to see how badly the ligament is affected. If the bone is broken, the doctor may order an X-ray. There are several treatments. It depends on the severity of the injury. Common treatments for mild sprains include giving time to heal and rest, physical therapy, and pain relievers. More severe cases may include other treatments such as immobilizing the area with a brace, or if the muscle is ruptured, surgery may be needed.
After treating a cervical sprain, there may be some complications. This means that after the sprain, you can have chronic pain, headaches, depression, permanent loss of cervical range of motion, or and disability. Not all hope is lost, because there are ways to prevent this sprain from happening. Muscle training and stretching are very important to prevent the sprain because they maintain the muscle strong and flexible. Warm-up exercises should be done, and you should not exercise when tired or in pain. This can help prevent any sprain. Let's go back to the situation of the motorcycle. In this case, you can be more careful and pay attention. That way, you prevent any injury happening to you or anyone close to you.